Hey, how's it going? Barnaby here. In this HelloLife moment, we're going to be talking about ADHD, which Dr. Jeffrey Chamberlain, family medicine specialist, most people assume is a bad thing, but there are some positive qualities that are perceived with being afflicted by ADHD.
That's true. For kids, a lot of times we see their hyperactivity aspects help them in sports or athletics. They're moving around, they're very active. Sometimes they're very social, and sometimes it actually helps them interacting with their peers. For older adults, a lot of times it helps them with creativity. They're think about a whole bunch of different things. They think outside the box, and so they do things that are very creative compared to people without ADHD. And then also sometimes with multitasking, if they've taught themselves how to do it, because they have a hard time focusing on one thing, they kind of weave in and out of a bunch of things. So they work on this for a little bit, then they're working on this, and they're working on this, and they're working on this. And as long as they've taught themselves how to stay productive, they can do really well dealing with a whole bunch of tasks at once.
So given that they seem to be having success in life on a couple of different fronts, would it be correct to treat this or just let it roll until it rears its head and presents negatively?
Yeah. Usually, I recommend if you have ADHD, always treating in the sense of sometimes we do interventions to help use your ADHD in more productive ways or help manage things well or organize things better. For using medications, though, I usually reserve those for people who we failed everything else and it's interfering with their life. If it's not interfering with your life and you're getting enjoyment out of the life and you're getting what you want out of life, why start a medication? We don't need to do that.
That's interesting because, I mean, if you're deemed to be quick-witted and keep a lot of balls in the air and you're gifted athletically, I'd say possibly it could be ADHD. Maybe it's just that you were blessed being good in all those things, but why mess with a good thing? But if it does start to act against you, that's when you should really dive into it.
Exactly. Yeah.
All right. Good advice right there. I swear to God, I have ADHD for all the right reasons. Just another HelloLife moment. Dr. Jeffrey Chamberlain, thanks so very much.